In our time, a surgery performed in a modern hospital, robotic arms, lasers, anesthesia, advanced devices, all of this feels completely normal to us, doesn't it? Have you ever wondered, Mace, how the very first surgery in human history took place? How did all this surgical knowledge begin? Where was the foundation of modern medicine, something that keeps millions of people alive, actually laid? Now, we are going back 9,000 years to one of the most courageous and maybe the most terrifying eras of humanity. For years, archaeologists opened graves in Peru, Africa, France, and they found something extraordinary: skulls. Skulls with remarkably carved round holes in them. These holes were no accident, not an animal attack, all made using the same technique, at the same angle, with precision that defies belief. This was the first known surgery in history, trepanation, deliberately opening a hole in the skull. The year, 7000 BC. Yes, 9,000 years ago, humans were performing brain surgery. Why would they do something so extreme? At that time, severe headaches, epilepsy, violent seizures were thought to be caused by evil spirits, and the way to remove them was to open a hole in the skull. Here's the shocking part. Today, modern medicine confirms that in cases of brain trauma or increased intracranial pressure, opening a hole in the skull actually works. Thousands of years ago, humans were unknowingly developing a life-saving surgical procedure. Even more astonishing, there were signs of healing around the edges of the skulls. This means the patients survived. Days, weeks, even months. Trepanation wasn't primitive torture. It was the most advanced medical intervention of its time. But then a question comes to mind. No metal tools, no sterile environment, no anesthesia. How did they perform surgery? Scrapers made from sharp stones, knives carved from bone, mild anesthetics produced from plants, herbal bandages to close the wound. Some operations lasted hours, sometimes even days. The surgeon slowly thinned the skull, thinner and thinner, until finally, a circular piece was removed. Today, scientists say this technique was far more skillful than expected. These people who mastered stone and bone were essentially the brain surgeons of their time. Time moves forward, and then we encounter the biggest problem with surgeries: pain. People endured unbearable agony, screaming, writhing, some even going into shock. Then, in 1846, the course of history changed. In a hospital in Boston, a doctor held a mask over a patient's face. The mask was filled with ether vapor. The patient relaxed, then drifted into sleep. For the first time in history, surgery without pain. This moment marked the beginning of modern surgery. For centuries, doctors considered touching the heart forbidden. You cannot operate on the heart, they said. But in 1893, Dr. Daniel Hale Williams broke this rule. A man had been stabbed. His heart was damaged. Dr. Williams opened the chest and stitched the tear. The first successful heart surgery. Humanity could now even touch the heart. Imagine a quick shift from a cave to a modern operating room, from drilling the skull with stone tools to robotic surgery, organ transplants, artificial hearts. 9,000 years of human ingenuity, courage, hope, and it all began with that first surgery performed in a cave with determination. No matter the era, human beings always find a way to survive, to heal, to hope. Thank you for watching. Don't forget to subscribe for more historical stories.